and I will, become strong. It doesn't happen. You have to practice day in and day out. Only then suddenly, when if there is a tournament, you are still prepared, right? So if you say, okay, when I'm under stress, no, I'll do deep breathing, it won't work out. You have to start from today itself. It has to become your habit. Then here it says that, sometimes people, the family members also do not understand the healthcare workers plight. So they feel that, oh my god, they're working with all these infected patients, and we might be also at a risk. Sometimes the neighbors could be very critical. So sometimes your own colleague could is better able to understand you, because both of you are in the same situation. If your family is supportive, it's a plus point, nothing like it. But suppose you are not able to find consolation with friends and family around, talk to your colleagues. So there is something called as peer-to-peer psychological first aid, how to help a colleague. Three things: facts, feelings, and future. So just try to understand what the situation is, what your colleague, in what situation your colleague is, what are the feelings that they are experiencing, be empathetic, and what is a plan for the future. And like, what are the problems that the person is facing: loss of appetite, sleep disturbances. So encourage self-care, any healthy activity, and then encourage them to practice these coping strategies, so that in the future they will be able to sustain themselves. Then if you are communicating with disabled people, so here you should understand that there are certain things that you need to keep in mind. There are many things actually, but I have selected only 4 of it. One thing is the tone of your voice. Okay, so speak very politely to them, be very patient with them, speak very politely, softly, and slowly. Speak directly to the person. Like, suppose if there is a child with a special disability, instead of talking to the child, many times we are talking to the mother or to the caregiver. So that's a wrong way of communication. So speak to the child, make the child understand what is going on, make the child understand the importance of hand washing, the importance of wearing a mask. And you can ask that person or the child, in what way will the person understand your communication. So basically it's our words, attitude, and actions that impact his life. Then another important thing is we have to link people with available resources, especially those who require mental health and psychosocial support. Because many people, they are not willing, they don't know whom to talk to, they don't know whom to ask. Sometimes there are two anxious people in the family, how are they going to help each other? So we have some headline numbers, and what you can do is you can put it on your fast dial in your phone, or you can just write it and put it on your fridge or on the wall, so that if in any emergency you can easily contact them. So these are some of the numbers, and they are all working numbers. I just casually called the senior citizen helpline just to see if it was working, because sometimes on WhatsApp we get messages, no, certain numbers are not working. So I just tried, it's perfectly working. So you will find these also on the net, and plus you can also download this if you are in the healthcare, if you're a working personnel. That is a mental health gap humanitarian intervention guide. It's a very good, it has very good content on how to take care of people with mental issues. So some of the numbers are COVID-19 helpline is there. Then for men, if anybody has any mental health issues related to COVID, I think this was launched in April. So you have the 108, or even 104 is quite helpful. Then women helpline number, because a lot of cases of domestic violence, child helpline number 1098, that's easy to remember. Then you have the All India helpline for COVID, which is initiated by Enhance. And then senior citizens, because they are the vulnerable group. So this is easy again, 1, and then 4567. And for students also, they have a website. You can just log in and all the details will be there. Then next, coming to message for team leader or managers in the healthcare facility. So one of the important responsibility of the team leader is to keep their staff protected from chronic stress and poor mental health. See, it's an interdependent role. They need their staff, and they have to understand that the current situation that all of us are in, it is not going to go away overnight, right? So we cannot say, okay, I will put a shift for 20 days. After that, everything is going to be sorted out, so then that person can rest. No, we know it's going to be a long-term issue. So you have to plan the rotation in such a way that they are also getting adequate periods of rest, or otherwise they will also get burned out. Then another important thing is good quality communication and accurate information. The team leader should also rotate the worker from higher stress areas to lower stress areas. Okay. And then maybe first in the screening, and then in the ward, and then back to screening. So obviously with all precautions. So they keep, they keep rotating from lower to higher stress areas. And the other, facilitate another thing that you can facilitate is the big buddy system. So what is the big buddy system? This we also follow in Hinduja, where I worked earlier in Mumbai. So whenever we join as a new employee, a senior is attached to us, or we are attached to a senior. So whatever issues we have, professional issues, personal issues, we can share with that senior, and that senior will guide us. So that senior is like my big buddy, like my big friend. So even in the picture, you can see, there's a red eye behind the small eye. So that is like a backbone or a support. So the buddy system helps to provide support, monitor stress, and reinforce safety procedures. And when people work in the community, see that they go in pairs rather than individually. And I often find that is really helpful. Like even previously when I had maids at my home, two maids come. Not because we are paying them extra or something, it's because they're sisters. And they talk to each other, they enjoy, they crack jokes, and quickly they finish the work. So for them also, it's not a burden. And for us also, work gets done easier, faster. And initiate and encourage and monitor work breaks, implement flexible schedules for workers who are directly impacted or have a family member affected by a stressful event, and ensure that you build in time for colleagues to provide social support to each other. Then you should also, as a team leader, you should tell your staff how and where to access mental health and psychological support. So those numbers you can give them also if your hospital doesn't have a facility for mental health services. Okay, and we have to understand that even the team leaders are going through the same stress. So each of us have to be supportive to one another, and if you have certain protocols in place, work becomes more easier and less stressful. And obviously team leaders have to be role models. Then next, we have to orient all the responders. Now there are certain people who cannot avoid work, like nurses, ambulance drivers, volunteers, case identifiers, teachers, community leaders, workers in quarantine sites. So they also should maintain their emotional health, but they should also know how to promote emotional health. So this is a list that has been prepared especially for the COVID pandemic. So it's easy to remember. There is ABC and 1, 2, 3. What is A? A is awareness. So just being aware of ourself, mindful of ourself. We have to notice our body, hands, legs, and feet, and we should remain oriented to the place, our own self, date, and time. So notice is, you can notice, and you can also tell in your mind. Yes, you can just move your hands and say, yes, these are my hands. And then you can just move your feet and say, this is my feet. Like how we do to children, where is your eyes and where is your head? So you may feel it is very funny, but it really helps to create awareness. And breathing. Now, many times we hear about deep breathing, but many people don't know what is deep breathing. So we have seen children, you've seen, they breathe from their abdomen. If you've seen a baby lying down, they breathe from their abdomen, whereas we adults breathe from the chest. So what is happening? We are not taking in adequate oxygen. That is why we are stressed, and babies are quite relaxed. So what you have to do, you have to first of all sit comfortable. Your feet have to be comfortably resting on the floor, or you just cross legs and sit on the floor. Keep one hand on your abdomen and one hand on your chest, and then take a deep breath. Like, are you able to see me? Hello? Hello?
Yeah, we can hear. We can hear me, ma'am.
You cannot see me?
Yes.
Yeah, we can see. We can see.
Okay. So just take a deep breath as if you are you're smelling a rose. Okay. Like that. And your abdomen has to protrude out, and hold for 3 seconds there. And when you exhale, do as if you are blowing out a candle. It should be per step. Okay, and you should feel that your hand is moving inward. So that is deep breathing. Then the third one is counting. So 3 things that you can see, like I can see my laptop, I can see pictures in my room, I can see my phone. So 3 things that you can see, hear, feel, smell, and taste. You have to say it aloud. Then one thing, what is one next thing that you are going to do right now? So maybe after the webinar, I'm just going to have a nap. So the next thing that you're going to do. Then 2 strengths. What are your internal strengths and what are your external strengths? So like ma'am was telling that I'm energetic, so that is one of my strengths. And like what other people think about you, 2 strengths. What you think about yourself, those 2 strengths, you have to say it aloud. And 3 thanks. So what are the 3 things that you're grateful for? Probably you're grateful for your life, you're grateful that you're healthy, you're grateful that you're living with your family. So these 6 things you should make the person to do. So that is psychological state. Then another thing, if somebody has urgent mental health and neurological complaints such as delirium, psychosis, severe anxiety, depression, then they have to be referred to a healthcare facility. Okay, and yeah, then next is when these people are on medication, so the essential generic psychotropic medications should be made available to them, because we cannot stop the drugs. These are long medications. What happens if they don't take the medicine? It is again back to square one. So all the time that you have taken, all the effort that you have taken to treat them, it's all down the drain. So don't ensure that somehow they get the supply of their medication. Then next, coming to message for carer of children. So me, like my family and the children in my apartment, together we have done a video. So everything is covered in that video. Just 2 points which I will explain after this. So
इसको इस दुनिया से उठा ले, घर को जलाओ दे, गाँव के पकौड़ा बनाओ उसके भगवान। भगवान सुबह इधर है क्या?
Yeah, so the two things that I did not include in this one was the timetable. Actually, I had forgotten to do that. So ensure that you prepare a timetable for children. So because now some of them till 5th standard, they are not going to school. Others are also having online classes. So a schedule to get up and sleep in time and to do activities in time, that's very important. Another thing is children become very clingy, very attached because they are not able to go out and meet their friends. They're not able to go out to play, and there's so much of talk around about this pandemic. So just be supportive. Just your physical presence is important, and emotionally also support them as well. Then next, coming to taking care of older adults, people with underlying health conditions and their carers. So it is the same thing that people who have cognitive decline or dementia may become more anxious, angry, stressed, agitated. So just provide practical and emotional support. This further we will see what are the other ways in which you can keep connected with them. Another thing is share very simple facts with clear, concise information in a respectful and patient way, because they take some time to understand. So be very patient with them and give them practical tips on how to reduce risk of infection, like hand washing, wearing a mask, and repeat the information whenever necessary. You can put it up in writing or in pictures around your house, and also in touch with them. If they are staying with you, converse with them regularly. If you are away from them, then you can definitely contact them through phone or video chat. Then, like I said, these people also need to have medication in stock, and few things like how to call a taxi if they want to order food, what precautions they should take, how can food be delivered, if they need to have medical care, whom they can contact. All these things should be explained to them. Then there are some simple physical exercises that they can perform. So this is called the interval style training or short bursts of exercise. So exercise snacks means short bursts of exercise. So like 20 seconds per exercise, you have to do brisk walking. That means every now and then just get up and walk for 20 seconds. And indoor cycling, if it is there 3 times per day, they can do that. And climbing stairs at least 3 times per week. So like we said, keep in touch with them. Then if you have old neighbors, if you are ordering anything online, just ask if they need anything. And if you are going grocery shopping, just ask if they need anything. You can buy them and just leave it outside their door. Then if they need medicines, when you are going to buy your medicines, you can also buy for them. Then this is mental health for people who are in isolation. So the only thing at the moment they can do is to maintain social network, and they have to exercise regularly, then regular sleep routine, eat healthy food, and same thing that you can seek information from authentic websites. So these are healthy sleep hygiene habits. We talk a lot about sleep hygiene, but what is it? So before bedtime, that is after 6 o'clock, you should avoid caffeine, nicotine, alcohol. Then you should avoid heavy meals within 2 hours of bedtime. That is, if you're going to sleep at 10, by 8, you should finish your dinner, and avoid heavy exercises from 7 onwards if you're sleeping at 10. And when you're getting ready to sleep, you develop a bedtime ritual so that your body knows that, every day that you're sleeping at 10 o'clock. And obviously, the environmental stimuli has to be minimized. That is extreme light, temperature, noise. And include an hour of quiet time before bed, such as reading, watching TV, or listening to music. Even when you're watching TV, please don't watch disturbing stuff. Otherwise, it'll only disturb your sleep. Then during the sleep time, keep your sleep regular, same bedtime, same rise time. But suppose by any chance you have slept late, but your waking up time has to be the same. That's one important point in sleep hygiene. Try and aim for 8 hours of sleep each night, and bedrooms are only for sleep and sex. Don't sit in the bedroom and eat, and don't do your studies there. Of course, if there is limited space, that's an altogether different scene. But try and not to do things on the bed. Otherwise, your brain gets confused whether bed is for sleep or for study or for eating. And next one, if you can't sleep after 20 minutes, get up and do something boring until you feel tired, then try again. Don't roll in the bed and don't wait for sleep in the bed. Get up, do something after 20 minutes, come back, try to go to sleep again. If you're not getting sleep, go do the same things and come back again. Eventually, you will go to sleep. Hello? Hello?
Yeah, ma'am.
Is this slide on?
Yes, yes, we can see.
Okay, okay. So all of us, we know that there are certain days when we can't sleep, but it's fine. The more you worry, the more sleep will go away from you. Okay. So don't worry about not getting sleep. Whenever you get sleep, just relax and go to bed. Then next, coming to message for pregnant women. So all of us know, and especially for the pregnant women, we have to say that it is normal to feel sad, stressed, scared during such a crisis. And we all understand that it is a physical lockdown, but it is not a lockdown of our mind and soul. It is not a lockdown of health, hope, and kindness. Relaxation and mindfulness. So one of the forms to relax is deep breathing, which we already discussed. Another thing is mindfulness. I was listening to a talk by Madhavan, very nicely said, when we are taking bath, we will be thinking about breakfast. We are not enjoying that bath. When we are eating breakfast, we will be thinking about our travel to office. When we are traveling to office, we will be thinking about what work we are going to do in the office. So we are not at all aware, we are not at all mindful of the present. Even we are in the present, but we are thinking about the future. So that also causes a lot of stress. Just enjoy the moment. Okay, that is what mindfulness is all about. This is what most psychologists also practice with their clients. Then, like we said, a timetable has to be there not only for children, for the adults as well. Listen, read, or watch news only twice a day, that we already discussed. Morning or just before dinner, so that the evenings are free for promoting sleep. And all this has been mentioned. Another thing is you can do meditation and yoga. Obviously, we know that this improves brain blood flow, increase production of endorphins, that is the happy hormones in our body, and it decreases oxidative stress. So, oxidative stress is the release of free oxygen particles, which actually causes tissue damage. So, yoga and meditation definitely helps in this. And I usually follow the Shilpa Shetty's yoga routine. Actually, I used to go for yoga before, even when I was a student. And I have tried different yoga videos, but it does not help me. But Shilpa Shetty's is really very good if anybody is interested. So you have a 15-minute workout schedule and you have a 40-minute workout schedule. So as per your time convenience, you can follow that. And there are two asanas. One is the Marjari asana and the Vyagrasana, that is the cat pose and the tiger pose, which is helpful for pregnant women. But definitely they have to check with a doctor. And if the pregnant woman still feels anxious, confused, or depressed, she can have an online consultation with a psychologist. And definitely, we know that unhealthy coping mechanisms, such as alcohol or smoking or tobacco consumption, is not the answer. She can also join online antenatal classes, and you have a lot of antenatal exercises also that maybe the gynecologist can also help her with. And obviously stay connected with family and friends. Then healthy diet, sleep, hygiene, that's common. Apart from this, she can do an online course, like take a hobby or rediscover an old one, which is playing an instrument, learning a new language, or reading. And she can also learn technology, because it might be an investment for her in the future. I was watching a video where they said that it's good to be updated with technology in today's times, because probably after the pandemic that is going to be in demand. And there are mothers or pregnant women who would enjoy making blankets or clothes or handmade toys for the coming baby or decorating a nursery. And she needs to ask for help if she feels tired, if she is not able to manage, so that her partner can take a greater share of responsibility, or the neighbor does the grocery shopping. Sometimes you have to demand for help. Sometimes you request your family members and they are lost in their own world. They don't help. So sometimes you have to demand, I need you to help me with this. Okay. And yeah, the pregnant woman also has to ensure that she has medicines for the next 1 month at least. And she can speak to the baby, connecting with the newborn baby, listening to music together. And this is one book that I would highly recommend to everyone, whether not out of COVID, because like for me, my first delivery was completely physically and emotionally traumatic. And for my second one, this book really helped me. So I would, because I have attended Sir's sessions, Dr. Aki Anand's sessions, and it's a good gift to someone. And everything, right from antenatal to postnatal care to caring for your children up to adolescence, everything is given in the book in the Indian scenarios. If you get a chance, please buy this book. And post delivery, also, you can encourage the woman to join online classes for newborn care, lactation counseling, and join some new mom support groups. Okay, this book is Dr. R.K. Anand's Guide to Child Care. Then in general tips for pregnant women, cancel all non-essential visits. The other things will come up in future slides. And she can contact her doctor if she develops symptoms of fever, cough, and breathing difficulty. Post-delivery, she can continue to take telemedicine services. And the good news is that the virus is not seen to cross the placenta and affect the baby. So there is no transplacental infection or vertical transmission. So all the care that is for general people, washing hands, putting space between self, avoid touching eyes, nose and mouth, coughing in the bent elbow or tissue. Then if the pregnant woman has mild COVID symptoms, so mostly the doctor will ask her to self-isolate, and it could include taking acetaminophen for fever relief, not paracetamol, okay, acetaminophen, and resting and drinking plenty of water. And if there are breathing difficulty, there is high fever, she has to definitely call the hospital, and she has to be taken to the emergency room. Another thing is, even at this point of time, she needs to check with the hospital, what are the policies, because now, because of all the screening and the admission protocols have been prolonged, so she has to be prepared well beforehand. And coming to so every woman has to be treated with respect and dignity. Clear communication by maternity staff. Somebody should be there with her, on whom she trusts. Pain relief strategies and mobility in labor where possible, and birth position of choice. Then whether breastfeeding helps, yes, we should initiate that early, even if the mother is COVID positive. But studies have shown that babies are not affected because there is no transplacental crossing or infection, or even in the breast milk. Then they can definitely breastfeed a baby if they practice respiratory hygiene, wear a mask, washing hands before and after touching the baby, routinely cleaning and disinfecting surfaces. And if she's too unwell to breastfeed, then she can express her milk relactation. After a brief gap, when she feels well, she can start lactation. Or you have milk banks. When in Telangana, we have human milk banks or mother's milk banks. From there, she can get milk, or even wet nursing. Somebody who is healthy, her relative, can also breastfeed the baby if the mother is a postnatal mother. Then this is for people who are mourning after a loss. So we have seen COVID deaths in and around, and definitely these people must be going through terrible grief. Why? Because now, even when you're hospitalized, visitors are prohibited, whether the diagnosis is positive or negative. Then funerals, burials are postponed. Then even if it is conducted, there is no presence of the family member. You cannot hug anybody. Nobody can hug you, like embrace you. And the social media is full of devastating stories. You are not, sometimes, in isolation itself, you they are directly taken away, and you have not got a chance to say goodbye to them. Sometimes every phone call you make, you don't know whether it is the last phone call. And people are also starting to make wills, that property wills. And there's a lot of confusion on whether we should ask them to remove the ventilator, whether we can afford the payment, that DNR status, do not resuscitate status. There's a lot of issues that are going on which can actually affect the mental health. But we have to understand that grief is natural after loss. Whatever emotions we are going through, we need to name them. Like, yes, I'm angry at this moment. Yes, I'm feeling irritable at this moment. Encourage them to speak it out. And this waxes and wanes. Sometimes they feel okay, sometimes they feel angry. So that waxing and waning goes on. And encourage them to experience positive emotions. Do one good thing, like maybe hug a child or say a prayer, and say that there is something promising in the future. That is, what is it that I can do in my future life? Now, one phase of my life is over with the death of my loved one. Now, a new phase of life is beginning. So, what are the new things that I can learn and I can do in this new phase of then we can strengthen our relationships by sharing stories, by accepting support and condolences and comfort from the other person. Of course, it's all virtual now. We should lower expectation for reciprocity. That means, oh, I went to that person's function, but that person did not even acknowledge. Now I'm going through a tough time. That person has not even contacted me. So don't hold those grudges. Okay, don't think that because I have done something for someone, they have to do it for me. You can share memories of the deceased person and basically stay connected. And yeah, something like you can honor the person on the social network. Maybe somebody shares some memory, somebody has written a poem, or somebody has somebody wants to present something to the family. So maybe it can just be a note of appreciation. So these things can be done. Yeah, it's all the same. And apart from this, you need to take good care of yourself with exercise, good sleep, healthy food. The person who is grieving should find pleasurable activities. They can write their experiences. Some don't like to write, that is fine. And they can also celebrate any tradition that has been in the family. Ask for support. You can contact your faith community, your priest or your pandit. That helps you, and you can learn new skills. Suppose if the person, if the wife has died and she was the one who was cooking at home, and now you have to take up the responsibility. So learn that skill. Okay, that way you can be occupied and you are able to connect with the deceased person. And of course, you can seek out community classes and resources if you have to learn a new skill. Many people have learned to cook. Many youngsters have learned to cook with videos. And this is something like, if somebody is in grief, when to ask for help. Suppose the person has maladaptive thoughts, everything is going to become worse, or they are thinking about the same thing again and again, or they have Monday morning quarterback. If that person was alive, it would have been like this. So then they have to see a psychologist. If they have dysfunctional behavior and bodily reaction, like they are not allowing you to talk about that. They don't want to talk about the memory of the deceased person, and they're not able to eat well, sleep well, not exercising. Or they are completely lost in the memories of the person. They are experiencing some somatic problems, aches and pains, vague aches and pains, vague somatic symptoms. Then you have to refer them. Or if they have emotional dysregulation, that difficulty managing painful emotions, irregular sleeping patterns, or unwilling to experience any kind of positive emotion, happiness or calmness, then they have to be referred. Then there are emotional issues in people who have recovered from the illness. So, they have recovered, they are happy that they have got a second life, and they want to go back to the community. But there is that fear whether my family members will be affected, whether people will understand, whether they will maintain, whether they will isolate me. And you may also have guilt that when you were sick, others were caring for you, but you couldn't do anything for them. So whatever we have discussed previously about eating well and sleeping and managing stress, all that should be done. This person should also train and again use coping strategies, helpful coping strategies, and share the positive story of recovery. So we'll wind up here. In short, the tips for positive mental health, the do's and don'ts is: do's is positive thinking, regular exercise, balanced diet, relaxation exercise, regular daily routine, socialization, taking a break from your routine work life, and other healthy lifestyle measures. And the don'ts are substance use, eating too much fast food. That is what we do, right? When they say take a break for meals, immediately we try to eat on some junk, which is just empty calories, doesn't provide us with any kind of nutrition. There is excessive online activity. From morning to even people are seeing news. Even one rise in one number is risen positive case, they come to know. So that should be avoided. Excessive watching television, especially news, partying, travel, focusing on the negative aspects of COVID-19 pandemic, posting about COVID-19 on social media and spreading fake news, and also believing fake news. So in short, these four things you have to remember is 1, 2, 3, 4, and home. Okay, good sleep, physical activity, good nutrition, and relaxation. So good nutrition, what you like, you should not eat. What you don't like, you should eat. You say, I don't like karela ka sabzi, that only you have to eat. So that is good nutrition, okay? That is not appealing to the taste buds, that is good nutrition. So finally, let's learn to cope with our new reality of being in this virtual life that includes virtual work, virtual consultations, virtual exercise lessons, and virtual family and friends meet. We know now even marriages are happening online, so life has become like that. And these are the references. So basically, I have taken most of it from the WHO website. Few are taken from experiences from people, and a few I have taken from other sources, the authentic sources. Yeah, one thing maybe because there is another minute. See, sometimes we are so busy at work that we don't get time to, they say, take a break and do deep breathing, of course, with the mask on and all. You can't do it, right? So one thing, what I have understood and learned, and I have already done a research on this. You have to train your mind. That is something called as auto suggestions. So like now I'm feeling so stressed out, I'm in the ward, I cannot take off my gear, I don't have time to eat. So I just calm my mind and I say, yes, I'm good, I'm relaxed, I can do this. That all is well funda, what Amit Khan did in Three Idiots, same thing you have to follow. So I had done a talk also on therapeutic touch about it. So when you touch a person, you be conscious, you say, yes, I'm giving healing to that person, I'm giving calmness to that person. And then when you touch the person, there is a lot of difference. So one thing is auto suggestions. You just keep repeating positive statements to your own mind. So that also is very helpful. So I think, yes, that's it. So we can discuss. As everybody slept off, there's no noise. I'm just trying to figure out how to come out of this.
Participants, if you have any queries, just put in the inbox. She will be happy to answer you.
Excuse me, ma'am. At the share screen, you can come out of this PPT.
That's what I'm not finding, the shared screen option. It was here, but it's there on the top. I'm wondering
Down.
where it is.
You can find it down, ma'am.
It's neither down, neither up. Strangely, I'm not finding it. Okay, another thing for the participants, I have also uploaded a video on YouTube on management of COVID-19. So what are some of the things that you can, buy beforehand and keep at home, so that it will be, you are prepared. You're not stressed out as to what will happen. And it's on, you can just type Pentagon Nursing Academy, Pentagon, Pentagon. I forgot to put it in the slide here. I'll just close this option and see if it is. Am I there or have I gone?
Yeah. Yes, still there.
We can see you, ma'am.
Please leave your queries to chat.
Sure.
Yeah, I'm not able to see you all. I think that's fine as long as you all are able to see me and listen, hear me. Are there any questions that have come up? I'm trying to do return to meeting, but it's not happening. Yeah.
Yes, you can also do it. Meanwhile, you engage. I'm engaged.
Participants, you can ask any queries.
Meanwhile. Yeah, you can answer.
I can see a lot of thank you. Thank you for your patient hearing.
Hello, ma'am.
Yeah.
Hello.
Yeah.
Here, I'm Yuvrani from Yamuna College of Nursing, ma'am.
Yes, Rani, tell me.
Especially for employees who are all working during COVID-19, no, ma'am. So how to promote our mental health well-being? Any tips, ma'am?
That's what, all that, those 4 things you remember. What was that? That is the sleep. Then that 1, 2, 3, 4, that is the exercise. And the that is the eat well balanced diet. And the om, that is the meditation. So that is what I said. Sometimes when you're in the ward, because even I have worked as a nurse and in the hospital, I know how busy it gets. You don't even have, sometimes you become hypoglycemic. You have not had your lunch, and by the time you realize, it's already 4 o'clock. So certain times we can't help. If you're not able to do these things, just try to do these auto suggestions. Yes, I'm well, I'm not stressed out, I'm calm. Try to use positive words. Instead of saying I'm not stressed, try and say that I am calm, I'm relaxed. Today, if you start practicing this, you may not see the benefit immediately. You have to keep practicing it on a continuous basis. That is what I said. Like, you cannot say just before the fight, 2-3 days, I will start training and make myself strong. It doesn't happen like that. Every day, day in and day out, we have to follow that discipline and train ourselves. Meditation has to be a part of our life. Eating good food has to be a part of our life. Actually, one thing which surprises me is people are talking so much about mental health, but it was not there in the past. Why? Because we have changed our lifestyle. If you see our elders, they get up at sunrise, right? So what happens when you expose yourself to sunlight? The rays, it triggers the, when it falls on the retina, it stimulates the pineal gland and it releases melatonin. So what melatonin does, it regulates your sleep wake cycle. So in the daytime, you will be very active. So by 6 in the evening, around sunset, your body becomes tired. So from morning, you are actually exercising. And once you get tired, you relax, you pray, you eat your dinner, and you go off to bed. But now what is happening? No sunlight. People get up at whatever time they want. They will go to sleep at whatever time they want. There is no demarcation of day and night. They eat whatever they find. Anything, even that is very surprising. Like, things that we feel are not edible, people are still consuming that. I mean, when nature has given you such good natural plant sources, why are we not utilizing that nature to our benefit? And then we say that mental health is affected. Yes, because we are going against nature. So people, including me, yeah, even I do that mistake. I'll say, yeah, I don't have time to do this. But what is more important? Your health is more important. Certain things we have to say no, because when we know that that is going to affect our mental health, we have to say no to it. Sometimes you may, you may be busy. You have to prepare lunch, breakfast, dinner. You may not have the time. So what you do, you prepare a brunch. That's it. You have to do a shortcut. If it is necessary for your health, you have to do it. If you are healthy, others are healthy. If you are sick, others will definitely fall sick.
Thank you, ma'am.
Any other?
Any other questions?
Any other questions, please?
Thanks. Lot of thanks.
So I want to thank each and every one of the participants on behalf of our MNR College of Nursing. And a very special thanks to Mrs. Mary Sebastian for your wonderful informative talk today. And I'm sure every one of us, all of us are really stressed out with what is happening in and around us. So this talk was really interesting and inspiring and more practical. So thank you so much. And to all the participants, thank you for your patient listening. And do join us also tomorrow in the next session. Thank you. Thank you so much, Mary Madam.
Ma'am, please call me Mary. Thank you, Shobna
Thank you,
ma'am, for
Mary.
giving me this opportunity to put forward my views. And it was wonderful having all of y'all on this platform. So thank each one of y'all, and especially Shobna ma'am and the MNR team. Thank you very much. So have a good day. Enjoy, as long as everything is in favor.
Thank you.
Bye-bye. Shall I